Okay. And I did want to ask, separate from what you've talked about, as schools, as people get ready to go back to schools, a lot in the county are starting virtually, but eventually there's the possibility that kids will be back in classrooms, and with that comes the likelihood that there will be some cases. What's the discussion been with school districts on how to not only handle that from a, keeping classrooms or schools open, but also just kind of messaging to parents? Is there talk of how to let people know how to communicate, and to kind of, I guess, manage the reaction to that?
And do you specifically mean if there is a positive case in the school?
Yeah, yeah.
Yeah. So there will absolutely be positive cases in schools. And I think we've been very clear about that. There is really no getting to zero and for the foreseeable future. So each school and each family has been going through a process of making a decision about risk factors, and the schools in particular about the ability to social distance, working with their teachers and other staff to make sure people feel safe. So we're seeing a wide range of responses around the county. The majority of schools are going to be virtual. We have, I believe, 5 or 6 school districts that are bringing some students back, and it varies across those districts. So when there is a positive, the Montgomery County Office of Public Health will be working very closely with these schools, and particularly with the school nurses. And there's already been a process in place to identify those contact people. We have asked all the schools who are doing any in-person to keep very good seating chart lists and attendance lists, so that we will quickly be able to know who might have come into contact with that student, and whether or not they were able to be socially distanced from that student, and all the relevant information that we would need to communicate. The County Office of Public Health will communicate with that student and their family, and any direct contacts or any individuals that we think are at risk of exposure, which means that they were within 6 feet for longer than 15 minutes. And then we will work with the schools, just like we do when there's any outbreak, whether it's measles or head lice, to work with them on the messaging that they want to share with their school community. So we'll work in partnership with each of the schools on that.
And understand this is a bit hypothetical, and it would vary depending on how the case or contacted, et cetera. But if there is a case, does it automatically mean that the entire school would just have to shut down, or could it be, even other kids in the classroom are okay, and a couple of kids maybe have to quarantine? Do you envision that? Is there a way to kind of answer that?
Yeah, absolutely. In fact, if you look at our school guidance up on our website, I think there's a chart that talks about what we call exclusion criteria. So if just one student in a school tested positive, hypothetically, and they were in a classroom where social distancing had been maintained, and all the other recommendations were in place, then definitely not would the whole school would not have to close. And again, depending upon the situation in that particular classroom, maybe a couple students might have to go out, but again, the intent would not be to close the whole classroom. However, if there were multiple positives, depending upon whether it was, let's say 2 children in a classroom, well, then that classroom would probably need to go home to quarantine and continue their learning virtually. If there were students that simultaneously became positive in multiple different classrooms or locations within the school, then that would be the type of thing where we might look at something more broad. So it really will have to be a individual decision depending upon the specific circumstances of that location. But we've talked through all of this extensively with our school superintendents. We continue to meet with them pretty much weekly. And, I think they are all, very prepared for this. I mean, particularly the ones that already have some people coming back. They are plugged in with us, and we're ready to help.